It refers to any group of symptoms attributed to obstruction of the coronary arteries. The most common symptom preceding diagnosis of ACS is chest pain, often radiating of the left arm or angle of the jaw. Acute coronary syndrome versus stable angina should be distinguished from stable angina, which develop during exertion and resolve at rest. In contrast with stable angina, unstable angina occurs suddenly, often at rest or with minimal exertion. Risk factors. Acute coronary syndrome, just like heart failure and stroke, are much more likely in people who have certain risk factors. These include smoking, high blood pressure, high blood cholesterol, diabetes, and physical inactivity. Pathophysiology. Atherosclerosis is by far the most frequent causes of coronary artery disease, carotid artery disease, and peripheral artery disease, but atherosclerosis alone is rarely fatal. Atherothrombosis is a chronic and multifocal immunoinflammatory, ever-proliferated disease of medium-sized and large arteries, mainly driven by lipid accumulation. Atherosclerosis begins to develop early in life and progresses with time, but the speed of progression is unpredictable and varies markedly. Signs and symptoms. Cardinal symptoms of decreased blood flow to the heart is chest pain. Experience is at times around the chest and radiating to the left arm and the left angle of the jaw. This may be associated with the diaphoresis, nausea, and vomiting. Diagnosis electrocardiogram. The setting of acute chest pain, the electrocardiogram is the investigation the most reliable distinguish between various causes. The treatment. People with presumed ACS are typically treated with aspirin, clopidogrel or tricardiol, nitroglycerin, and if the chest discomfort persists, morphine. Other analgesics such as nitrous oxides are of non-benefit. Prevention. Acute coronary syndrome often reflects a degree of damage to the coronary by atherosclerosis. Primary prevention of atherosclerosis is controlling the risk factors, healthy eating, exercise, treatment for hypertension and diabetes. Prognosis time score. The time risk score can identify high risk patients and has been indefinitely validated.